Sophomores in high school thinking about going to college or thinking not to go to college. It's not going to be easy, but you're going to see that you're able to do it once you walk across the stage and have a degree that you earned.
MCH stands for Maternal and Child Health, and our program is called the Maternal and Child Health Pipeline Training Program. What it is a pipeline initiative. Recruits, supports, trains, and retains students from underrepresented and disadvantaged backgrounds and moves them successfully through undergraduate and from undergraduate into graduate training.
And we got to work with people in the community who had children with special needs. It helps you grow as an individual, having those eye-opening experiences and growth as a person in the world.
I've learned that I'm really capable of excelling in areas that I never would have considered otherwise from, if I would have never joined MCH.
It allowed me to build myself in a way, my resume, to make me more competitive. One of the things I was able to take all that was to apply for an ALP fellowship here at UWM, which I was awarded.
A program like this is designed to start to achieve a workforce that has the diversity and representation that matches the population of the United States.
There was a couple different opportunities. One of the big ones was the ability to work with a mentor. With such big classes, to get that one-on-one opportunity to work with someone is really helpful.
Everyone that I have met has always given me, nothing but support, nothing but encouragement to become a better student and a better person. They've always seemed to have my back.
One of the big components of MCH is leadership, whether it's in the community or in profession.
We do a summer institute, and then we follow that up with a leadership retreat. Through them, we've got the opportunity to have the students work together and to start not only their own leadership development, but developing as a cohort, sort of put into situations where we expect them as a group to lead.
Through that retreat, I really learned that I was very analytical, and that was a skill that I never really knew I had, and through MCH, they really encouraged me to use that skill.
The amount of leadership development that we did, especially when we took the trip to Madison, to learn about legislation and advocacy, was really a big takeaway from there, and being able to now advocate for your profession.
So we developed a summer bridge program, and the focus of that program was to help 8th graders write their essays for their high school applications. It's actually kind of a beautiful model. Here our students are applying to get into graduate school and learning how to tell their story and how to have their dreams, and now they're backing it up and they're doing the same thing in working with the middle school students on how to tell their story and how to have their dreams. There's not another maternal and child health pipeline training program in the state of Wisconsin. There's actually only 6 in the country.
In terms of whether it's applications or even interviews, to have that, you were part of a big program like that that's not offered throughout the country was very helpful.
If you're going to college to really be involved in the community and to become a well-rounded student, MCH is the place to go. 95%
of students coming through this maternal and child health pipeline training program successfully go on to graduate school in the healthcare fields. That's a really high number and something we're really proud of.